Hi, I'm Shuai and I'm here to help us in our pathology exam. This time I'm going to talk to everyone about coronary heart disease. It's really annoying. I keep seeing all these specimens of coronary heart disease like coronary atherosclerosis everywhere, but now I can't find one. So I have no idea where it is. So now it's just boring me. So ischemic heart disease. What is it? It's a group of syndromes that results from myocardial ischemia. The pathogenesis is decreased blood supply and increased cardiac energy demands. So it's basically an imbalance between perfusion and demand of the heart. Angina pectoris is intermittent chest pain caused by transient reversible myocardial ischemia. The patient usually have substernal or pericardial chest discomforts. They could describe it as constricting, squeezing, or knife-like, or choking. Could happen. So myocardial infarction, or we can call it shortened as MI. So 40 to 50% of that happens in the left anterior descending coronary artery. 30 to 40% of that is right circumflex artery. 15 to 20% of that is left circumflex artery. So left anterior dysentery, right circumflex artery, and left circumflex artery. So the primary lesions are caused by anemic infarct, or the typical lesions that you can see is like anemic infarcts. They are yellow or gray colored and they're dry and irregular. So the progress, like a patient has a MI, so what are the progresses? So from half an hour, nothing actually happens to them, but up to 4 hours, there's some dark nodding on the heart. Up to 12 hours, there's a lot of dark noddings. Up to 3 days, the dark noddings with yellow tan infarct in the center. Up to 7 days, the hyperanemic border center yellow tanned, and it's becoming softer and softer. On the 10th day, it becomes yellow and tanned and soft, and it's depressed with red tan margins. On the 14th day, it becomes red and gray with depressed infarct borders. On the 8th week, it becomes gray-white scar tissue, progressive from border to the core of the infarct. And after 2 months, the scarring is complete and it starts to heal. So what are the complications of MI? So the first complication is after the MI, the papillary muscles might dysfunction or they might rupture. The second is myocardial rupture. Third is ventricular aneurysm. Fourth is mural thrombosis. And fifth, the post-MI syndrome that include acute pericarditis, acute left heart failure, cardiogenic shock, and arrhythmias.